Thank you, Mr. Scott. Ms. Bonamici?
Thank you, Madam Chair. I really appreciate this conversation. Thank you to our witnesses for your expertise. I think it's been a difficult but very important conversation to hear that we are regressing as a country when it comes to maternal and infant health. The well-being of mothers and babies are sort of fundamental measures of any nation's development. And to many Americans, I think the statistics that we've heard today might sound like they're coming from a different country or a different time. But it is a reality that we have to face. So we must face it. We must address the failings and improve outcomes for all families. And we've touched on several policies. Particularly, want to point out the inexcusably stark disparities for racial minorities. I'd like to emphasize a point made by several of the witnesses that we can improve the likelihood of healthy births even before pregnancy. Access to comprehensive reproductive health, including contraception and prenatal care, empowers women to make decisions about when and in what circumstances they choose to become pregnant. I'm currently working to update legislation I introduced last session, the EQUIP Act, that will encourage healthcare providers to routinely ask women of childbearing age about their intentions regarding pregnancy and to provide appropriate care in response to those conversations. March of Dimes was one of the organizations that endorsed the legislation because these pregnancy intention screenings improve the likelihood of healthy births. It's kind of a win-win because it is good for maternal health and it also reduces unintended pregnancies. And some of you might have noted that Oregon was the only state that's got an A- in the March of Dimes report. In all fairness, we don't have a lot of racial diversity, but we also have many clinics that are using the sort of one key question, pregnancy intention screening, and we also sort of aggressively expanded Medicaid. We have coordinated care organizations. So we're doing a good job in many ways, but there's still a lot of work to do. We have to make sure that we're addressing those implicit biases. Dr. Kerr-Perry, you spoke about positive health outcomes being dependent on implementation of all sexual and reproductive rights. Can you talk about how those rights might not be respected in healthcare settings pre-pregnancy and how policies can take that into account?
So I usually, when I'm doing data, I point out that although the United States is the worst in the world when it comes to maternal mortality, and black women are dying at 3 to 4 times the rate, that also means a lot of white women are dying that should not. And places like Oregon give us an example of what we could do better as a country if we invested in everyone and invested in things like insurance and other things. So it's important for us to think about when you restrict access to contraception. So we have data, my colleague Maeve Wallace and others, where the places that have more restrictions on access to contraception have the worst outcomes for maternal and child health. Right. So when they say language around we're making things safer for moms, you're actually making things worse. So the data is the opposite of this narrative around safety. So restrictions for sex education causes harm, causes death.
Absolutely.
Restrictions for access to birth control, for LARCs, for abortion, all those things cause harm and cause death. The more you put policies in place that are barriers, the more that women and children are more likely to die.
Right. Our legislature, with a bipartisan basis, passed legislation to fill contraception prescriptions for a whole year rather than short term, which my daughter really appreciates. Yes. So I recently visited a WIC clinic in Washington County, Oregon, and saw firsthand how important these services are for women and families who want to give their children a healthy start in life. I just want to mention, in light of the public charge opinion from the Supreme Court yesterday, I think we're going to see more and more families afraid to reach out for services. But WIC serves almost 15,000 people countywide. 79% of clients are working families and 22% are pregnant. We know that this nutrition, education, and connection is beneficial in terms of improving birth weights and reduction in premature births and fewer infant deaths. Ms. Stewart, studies continue to confirm WIC's role in reducing the likelihood of preterm birth. Only a slight majority of pregnant WIC recipients, just a little more than 53%, are certified for the program in their first trimester. Do you know why this is, and what can we do to better encourage certification of pregnant women?
A lot of people are very shocked when they find out how important WIC is in terms of serving pregnant and postpartum women, infant, and children younger than the age of 5. Almost half of the 4 million babies are born in the U.S. have been able to access WIC, and so it's an important program. We do think that having more access and having more community workers and community access to make sure that women understand how to overcome the barriers to
Right.
become eligible for WIC is really important. WIC has proven to be one of the most effective evidence-based programs to ensure that, to your point, that again, we can improve health outcomes, reduce infant mortality, reduce the risk of preterm birth. We're strongly in favor of expanding and improving access and looking at ways in which to improve those community access points as well.
Thank you. And I see my time has expired. I just want to say how important paid family leave is, that we are the only industrialized country to not have paid family leave, and what a difference it makes. My state, at the state level, passed paid family leave, but we absolutely must, as a country. It's shocking that so many women go back to work within just a couple of weeks. I was fortunate. With my first child, I was able to take 6 months off. Most women can't do that. And I still, I had to explain to people why I needed to take a break to go pump in the restroom. And so, having paid leave really makes a difference for a healthy start for children and families. And I've gone over my time, so I yield back, Madam Chair. Thank you very much.